Mathematically, if we try to evaluate these two procedures mathematically, how would that represent? In both the process, we are reducing the viable load of the organism on any surface or any article, right? So, how it is different between sterilization and disinfection in those things? So, one aspect is the type of the organisms that we are dealing with, right? So, in sterilization, we are dealing with to kill all type of viable organisms, including bacterial spores. Now, why the bacterial spores are important? Because bacterial spores are the hibernating form of the vegetative bacteria, and they are resistant to various environmental conditions, including temperature, pressure, etc. and etc. Now, any process which reduces the load of the bacteria on any surface or article, it shall reduce if the reduction is at least 10 to the power 6, we call it sterilization, right? And in disinfection, generally it reduces by 3 log reduction. So, that is a very big difference. Again, depending on the type of the organisms, we can also differentiate between the various types of disinfectants. Okay. Now, what are the microorganisms which cause infectious diseases in human being? Okay, bacteria, fungi, then parasites and helminths, okay, and fungus and viruses. And there is something called as prion proteins. Those are not organisms, those are proteins which can cause various diseases. Okay. So, among all these organisms which are capable of causing human disease, the most resistant type is the bacterial spore. Okay. Among the viruses, we can divide the virus into two types. Some of the viruses will have a lipid outer layer on the surface, which is derived from generally human epithelial cells. Those are called as enveloped viruses. Now, if this virus loses its envelope, it cannot enter into the human cell, rendering it neutralized. Very common example would be influenza viruses, the recent coronavirus. So, whenever we are using an alcohol based hand rub or soap and water, what happens is the lipid envelope is damaged, hence the virus is rendered non-infective. However, the other type of the viruses which do not have an envelope, they are more resistant. Okay. Now, coming to the types of disinfection, if you look at this chart, the disinfectants had been divided into 3 types. The first is called as high level disinfectant, then intermediate level disinfectant and low level disinfectants. Now, what you have to understand is the basis of this classification. The basis is simple. Not everything can be sterilized. If you recall the process of sterilization, there are physical methods, and among the physical methods, the very commonly used methods are okay, dry heat and moist heat, that is an autoclave. For dry heating, it could be example as a flaming or a hot air oven. Anything else? Radiations, both ionizing and non-ionizing radiation, and other methods like a plasma sterilizer or an ethylene oxide sterilization. These are the common processes. But there lies the problem. In all these things, we are putting the article inside a machine, either a hot air or an autoclave or a steam sterilizer, whatever it may be. What about the surfaces? For example, in an operating room, there are many surfaces. The operating table, the various surfaces that are touched, those should also be devoid of microorganisms. Otherwise, what will happen? During the procedure, all the microorganisms will enter the human body and will cause infections, right? So, we cannot take the whole OT table and put it into a steam sterilizer, right? So, we need some things which we can apply on these surfaces, so that these surfaces may be rendered as non-infective. That is, microorganism load can be reduced. Hence, these disinfectants are used. Understood? Please remember, disinfectants are not used on human skin. Whatever agent that are used on human skin, those are called as antiseptics. Okay. So now look at this types. For high level disinfectants, we have few chemicals, notably aldehydes, glutaraldehydes, orthoparaldehyde, paraldehydes, formaldehyde, or even hydrogen peroxides. Aldehyde will have an aldehyde group which will attack the cells. Similarly, hydrogen peroxide will release nascent oxygen and thus leading to the disinfection. Now, if we look at the intermediate level disinfectants, those would include the alcohols. Alcohols including phenols. I think you are pretty much aware of phenol. Where have you heard about phenol? In chemistry, and routinely it is also used as a floor cleaner. The phenyl name is derived from the use of the phenol. However, only difference is when we are using it for household purposes, the strength is very low. So these would include alcohols, phenols, and halogens. Halogens would include iodines and chlorines. I think you have heard about chlorination of water, and we also use tincture iodine on skin before any procedure. We prepare the skin. And finally, in the low level disinfectant, we have quaternary ammonium compounds including chlorhexidine. These will commonly, you have seen mouthwashes, Listerine mouthwashes, they contain chlorhexidine. Various antiseptic lotions like Dettol, Savlons, they have quaternary ammonium compounds. Okay. So, what is the purpose of this disinfectant? The high level disinfectants can work against most of the microorganisms which cause human disease. However, they may not work on bacterial spores. Okay. So, other than bacterial spores, they will be acting on almost all microorganisms. The intermediate level, they can act on most, but they have no efficacy on certain organisms like Mycobacterium tuberculosis. Okay. All these things will be very important even in our routine activity. I'll come to that later. Okay. Now let us look at high level disinfectants. Now this is very important. One is sufficient concentration and suitable conditions. These two are very, very important. If we dilute the same chemical, what will happen? Its efficacy will get reduced. That is the concentration. And the conditions means some, especially the halogens, they has to be prepared, freshly prepared. Okay. Because as the time goes on, their activity will reduce. So whenever we are dealing with disinfectants, two things should be very, very important. Whatever chemical we are using, it should be used in the ideal condition and in sufficient concentration. If the concentration is reduced, obviously it will be rendered ineffective. The next important point that you should know is the mechanism of action. I have already told you the common high level disinfectants are aldehydes. The common aldehydes would be glutaraldehyde, formaldehyde, orthoparaldehyde. How do they act? The aldehyde group will attack the proteins and inactivate them, and even they will damage the nucleic acid, especially in bacteria. Now, in the last class, have you been taught about Spaulding's classification? No? Okay. The Spaulding classification is a classification that is used to classify the various medical instruments that are used on the human body. Okay. And they are classified into three types. One is called as the critical, semi-critical, and non-critical. Now, what is the critical? That means any instrument which enters into the human body which is normally sterile. That means no microorganisms are present in those areas. Then we call it as a critical instrument. Can you give some examples? No, needle, not syringe. It's the needle which enters, whether you are giving an intramuscular injection, whether you are giving intravenous injections, all are entering into the sterile side. You are doing a lumbar puncture, you are entering into the cerebrospinal, taking the cerebrospinal fluid, that is a sterile site. You are putting a central line catheter in the large vessels, that is a sterile process. Whatever operative instrument that are using in any surgery, all are entering into the sterile site. So those are critical instruments. So what is the primary requirement of this critical instrument? They should be sterile. So any instrument which enters into a normally sterile body cavity should not have a single microorganism in them. If it does have, what will happen? It will cause infections. Understood? That is called as a critical instrument. Next comes is the semi-critical instrument. Some instruments do not enter into the sterile body sites. However, they enter into mucosal surfaces. Now, normally most of the mucosal surface of the body will have some kind of microorganisms. That is the part of the normal microbiota or normal flora. For example, suppose a patient is undergoing a colonoscopy. So the endoscope is entering into the colon. The colon will have many bacteria, right? The scope need not may be sterile because it is also coming in contact with various microorganisms. That is true. But however, suppose I have used the endoscope on one patient. After the endoscopy is done, I have to use it on another patient. Can I use it as it is on the next patient? Why? Yes, because infections can be transmitted from one patient to the other. So what we need is we need a process so that we can put the endoscope in that process so that whatever microorganisms that have come in contact during the process are now degraded, so that this endoscope can be reused for the next patient. Understood? So for this thing, what we need is a disinfection. Okay, it need not be sterilized, but we need disinfection. And what kind of disinfection is needed? We need a high level of disinfections, because normally on the mucosal surfaces of the human body we won't find the spores. What we will find is the vegetative bacteria. So these vegetative bacteria can be easily killed by disinfection. So these endoscopes, other examples would include anything else? A tongue depressor used during collection of throat swab, that is coming in contact with the mucosal surface. In gyne and obs, for pervaginal examinations, various endoscopes are used, or suppose a laryngoscope that has been used for examination, all will come under semi-critical instruments. And finally, what are non-critical instruments? Non-critical instruments are those instruments which come in contact with intact skin. Please remember this word, it should come in intact skin, not on denuded, abraded or ulcer bed, no, intact skin. Examples would be, okay, hammer, that is a good thing. Stethoscope, very most common example is a stethoscope. Thermometer can also be considered as non-critical if auxiliary temperature is used. However, if the thermometer is used inside the mouth, it should be exactly. So this is a very simple classification of Spaulding. So we have critical, semi-critical and non-critical instrument. Now, an example of high-level disinfectant is a Glutaraldehyde. It is commonly used for semi-critical, example endoscope. Various other methods like aerial disinfection, concentration is very important. This can be asked in your examination, that is for glutaraldehyde that is commonly used for disinfection of endoscope, what should be the concentration? It should be at least 2%. And there is a duration. The duration is 20 minutes. That means suppose I have done bronchoscopy on one patient. After the procedure is over, first thing that I need to do is clean the bronchoscope and then put the bronchoscope inside a glutaraldehyde solution. The solution must have at least 2% glutaraldehyde, and after putting it inside the solution, it must be kept there for minimum 20 minutes. If both these factors are altered, then disinfection will not occur. Okay. Similarly, we can have orthoparahaldehyde, formaldehyde. Formaldehyde was used extensively many years ago, but it has been considered as a potential carcinogen, hence it is not used now. Okay. Next is peracetic acid and hydrogen peroxide. One important part of hydrogen peroxide is that, what is hydrogen peroxide? H2O2. So what happens is, it degrades into water and nascent oxygen. The nascent oxygen attracts the molecules and causing lysis of the organisms. Okay. Next, let us look at the intermediate level. Intermediate level disinfection, I have already told you what are the intermediate level disinfectants. Those are the alcohols, halogens and phenols. So alcohols, very commonly, what are the alcohols that are used? Isopropyl alcohol. It is used for, yeah, both hand sanitizer and also in preparation of skin. But where importance lies is the concentration of the alcohol. The alcohol that is used as a hand sanitizer contains what amount? কত পার্সেন্ট থাকে? হ্যাঁ? Okay. Now look at these things. Alcohol based hand rub, that is what we use for hand hygiene. This can be used for very small non-critical instruments like a thermometer or a stethoscope. Suppose you are in the ward, you have examined a patient and you have put the stethoscope on the patient's body. Before moving on to the next patient, you must get it cleaned. So you can easily take the hand sanitizer that is available in the ward and clean the stethoscope. That is the diaphragm of the stethoscope. Also, it can be used for small medical devices. If you remember, during collection of blood for culture, I have told you that before injecting the drawn blood, the hub of the bottle must be cleaned with alcohol, right? So all these small cleanings can be easily done with alcohol. However, please remember, the concentration should be 60 to 80%. You can remember 70% as the standard, not less than that. And how long you should keep the alcohol? What should be the duration of exposure? No, as long as it takes to evaporate. Okay. So these are the few uses of alcohol, and there are some disadvantages of alcohol, like it's a flammable, so obviously you cannot use it in a place where there is a open flame, it will be a fire hazard, etc. and etc. Now let us look at phenols. The phenol is one of the first disinfectant that was used. It is also called as carbolic acid. If you go to the ward, you will find in the nursing station there is a long forceps which is used to pick up other instrument, gauges, etc. That is called as Lister's forceps. So named after obviously Joseph Lister, he designed that forceps so that we do not need to use our hands to pick up instruments which are used on the patient body, thereby reducing the chances of infections, iatrogenic infections. Okay. So how does it act? It acts directly and disrupt all cell proteins including the protoplasm of the cell. Now please remember, it not only acts on microorganisms, it is also hazardous on the human skin. So it should not be used on human skin. So commonly cresol and lysol are used. Lysol, I think in a smaller percentage you will be aware that It is used as a float disinfectant, both in hospitals and in. Now, what is the most important part? Look at the last line. It is 5% phenol, right? That is the concentration. And why it is important? Because it can be used for disinfection of sputum specimen. Please remember, most common and most infective form of tuberculosis is, if we leave aside laryngeal tuberculosis, it is pulmonary tuberculosis, where the organism comes out with sputum. Now, this is the actual problem. Suppose you encounter a patient who is having respiratory problem like cough, fever, etc. and etc. And after proper microbiological evaluation, you have diagnosed the patient as a case of pulmonary tuberculosis. Fine. And you have also initiated anti-tubercular therapy. But the patient will take some time before he recovers. Till that time, every time the patient coughs out, the organism will come out in the sputum. Now, that is an hazard for other people living in the same house, because they will also get infected. So, you must advise the patient to discard this sputum, that whatever comes out from his mouth, safely. How to do that? You cannot advise him, okay, collect in an area, then go for sterilization, this. That is actually not feasible. Easier option is ask him to spit in a container, and that container should have a phenolic compound where the concentration should be at least 5%. Okay. So, these are the practical implications of disinfection. Okay. Next, let us look at the halogens. Halogens commonly used are iodines, which have a direct activity against the microbes, and there are two preparations of iodine. The one is called as the tincture iodine. A very common trade name is a betadine, that is commonly used. So, it contains 2% iodine in the form of potassium iodide. The other is an iodophore, that is iodine is carried with povidone. I think you have heard about povidone iodine. It is an ointment which contains iodine. So, what is the role of povidone? It releases the iodine very slowly. So, it can be used in the form of ointment. But suppose I am trying to disinfect in the skin, I am looking for asepsis of the skin before an surgery. What preparation of iodine should be used? Tincture iodine or iodophore? Why? Because the iodine is released very rapidly, hence the asepsis of the skin will be done very quickly. But suppose there is a wound and I want the patient to apply the ointment, and for that we can use the povidone iodine, because it will release the iodine slowly but in a sustained way. Okay. Now, this is the percentage that is very important. Now, look at the percentage. Commonly 1% or the least percentage is used as oral antiseptic or mouthwash. The highest percentage, that is 10%, is used for surgical skin preparation, and the form would be tincture iodine. Less, like 7.5% or 5%, can be used for wound cleaning and hand cleaning. Wound cleaning, especially suppose there is a road traffic accident, the patient has an open wound with a lot of say soil and etc. debris are present, we need to clean it thoroughly. So, only soap and water would not help over there. We need some disinfectant, so that the microorganisms which are already present on the wound can be killed. For that, we need to use iodine 5 to 7% on this percentage. Okay. Now, I think you can understand the importance of percentages. Okay. Next is chlorine and hypochlorite. The most commonly used agent is a hypochlorite. What is hypochlorite? HCl. So, it degrades to produce chlorine, and this chlorine this free chlorine directly attacks the cells, the proteins inside the cell, and thereby killing the organisms. The chlorine can be, obviously hypochlorite can be in either liquid form or in a powder form. So whatever form it may be, the most important part is it should be freshly prepared. Why freshly prepared? Because the longer the duration it is kept after preparation, the chlorine will be slowly released off, and after a certain point of time there will be no free chlorine. That is the molecule which actually achieves the disinfection. So whenever we are using hypochlorite, we should use freshly prepared hypochlorite. The most commonly used hypochlorite is, now if it is 5 to 6%, we have what is called as 50,000 parts per million chlorine in the solution, and the contact time is about 10 to 20%. Why this is important? Because this is the most commonly used disinfectant, especially in the wards and in the laboratories. For example, suppose I have taken a patient sample, pus sample, in a syringe. Now I need to discard this sample or the slides, whatever I have prepared for examination. Those has to be discarded first in the hypochlorite solution. It may be infective, I don't know, right? Similarly, suppose inside the ward there is a spillage of body fluid. There could be many body fluid, say a urine or a peritoneal fluid collection or a pleural fluid collection, and it spills on the floor of the ward. What we need to do is, we need to do spill management, that will be taught to you later on. But the most important part is, during spill management, the disinfectant that is used is freshly prepared hypochlorite solution. And please remember the contact time. The contact time is about 10 to 20 minutes. Okay. There are some methods where the load of the microorganisms are reduced to certain extent that it can be used for human beings. However, that is not disinfection. The very common example is pasteurization. I think you are already aware of pasteurization. What is pasteurization? Whatever milk, packaged milk that we consume, all has been treated with pasteurization. Because boiling will only kill some of the organisms, but some will even remain after boiling. But what happens in pasteurization is that we heat the milk at a very high temperature and then rapidly cool it down. The sudden thermal shock kills most of the microorganisms. Now, very commonly pasteurization is used for milk, but pasteurization can also be used to disinfect or say render it for human is various fluids. Acha, there are many many substances that are used. For example, immunoglobulins, albumins, these are used for various therapies. Now, these are the some of the things. If we continuously hit them, what will happen? Whatever the protein is present in them will denatured on high heat. So these materials are also purified either by pasteurization or by filtration. Remember, in sterilization, there was one part, that is filtration. Filtration can be used not only for fluid but also for air. So this is one of the methods. The next method that can be used for disinfection is called as ultraviolet radiation. During the recent corona pandemic, I think you would have seen that in many places people were keeping their mobile phones, other belongings inside small chamber with a UV lamp, and after a certain period of time they were taking it out. So what they were doing? They were disinfecting their commonly hand. Okay. UV radiation can also be used for sterilization. The only difference is the duration of exposure. Commonly UV radiation is also used even in water filters. If you go and look the various water filters, even in, which are used inside home, they will have UV radiation. Okay. So these are the commonly used disinfectants. So one will be the high level, the other is the intermediate level. The last part is the low level disinfectant. Now what is the importance of the low level disinfectant? They destroy the vegetative bacteria, enveloped viruses, variable action on non-enveloped viruses and fungi, but no action on tubercular bacilli, that is mycobacteria. Okay, understood? The main differential point you have to remember this one. So in what is the high level disinfection? It acts on all organisms, may or may not have action on bacterial spores. What is intermediate level disinfectants? They will kill most of the almost all organisms, have no action on bacterial spore, but can kill Mycobacterium tuberculosis, that is tubercle bacilli. What are low level disinfectants? They act on vegetative bacteria and enveloped virus, may have some action on non-enveloped viruses and fungi, but have no action on tubercle bacilli and bacterial spores. So what are these low level disinfectants? First is a quaternary ammonium compound. So these are commonly used for disinfecting surfaces, any kind of surface. It could be a table. Suppose you go inside a ward, there is a highly infectious patient. Now the patient got cured and was discharged, or suppose the patient died. The same environment has to be cleaned. So for that we can use this low level disinfectant for routine cleaning. If the patient is a diagnosed case of infectious disease, then we need to use high level or intermediate level disinfectant. But for routine cleaning, we can use this quaternary ammonium compounds. The mechanism of action is that it inactivation of the energy producing enzymes and denature of essential proteins. Most common example is benzyne ammonium chloride. There are many other uses. And what are the uses? The first is hand hygiene. Next would be mouth washes. Third would be similar to mouthwash. Body washes are given to the patient before surgery. Please don't get confused with these body wash solutions with skin preparation prior to surgery. These body wash solutions are given a night before the surgery, whereas skin preparation is done immediately before the surgery. Okay, and routine skin disinfectants can for use after surgery. What is the advantage? The advantage of quaternary ammonium compound is that it has a residual activity. So after you are using in your hands or any body surfaces, the action remains even after you have used it. That is a prolonged action. The next important part is it does not cause damage to the skin. Intact skin may cause damage on non-intact skin. So whenever you are using these chemicals, always ensure there is no abrasion, cut or open wound on the skin. And because it does not directly affect, so any substance which has any organic matter on them, their action will not be good. What do I mean by organic matter? Suppose you have used any instrument on the patient's body, and after that, suppose there could be mucus, there could be stool particle, etc. There are many particles that can come out from the body. If the instrument has those organic matter, the first thing you need to do is you have to clean it. If you don't clean it, these chemicals will not be acting properly. Okay. The last part that we have come is called as a cleaning agent. Now what is a cleaning agent? নামটা পড়ে কি মনে হচ্ছে? What is a cleaning agent? Any agent that is used to clean. The question is clean what? Instruments. No, instruments are washed. Instrument should be washed before sterilization or disinfection. So what needs to be cleaned? Floors are disinfected routinely. তাহলে cleaning কি করা হয়? আর এই লাইনটাতেই তো লেখা রয়েছে কোনো কিছু করার আগে ক্লিন করতে হবে। বারবার বলছি অর্গানিক ম্যাটার থাকলে হবে না। আরে বাড়িতে কি দিয়ে পরিষ্কার করা হয়? জামা কাপড় কি দিয়ে ক্লিন করো? সোপ, ডিটারজেন্ট এক্সেট্রা। তো এই যে পয়েন্টগুলো লেখা আছে এগুলো কিসের পয়েন্ট? ইজিলি ইমালসিফাইবল মানে কি? জলে মিশতে পারবে। স্যাপনিফাইবল মানে কি? স্যাপনিফিকেশন কোথায় পড়েছিলে? সোপে। দেন ওয়াটার সফেনিং, হার্ড ওয়াটার, সফট ওয়াটার স্কুলে পড়েছিল, মনে আছে তো? নন টক্সিক কেন? জামা কাপড় কি হাত দিয়ে কাচা হয়, তা টক্সিক হলে তো তোমার হাতে ইরিটেশন হবে। অ্যান্ড ফাইনালি শুড হ্যাভ এ সারফেক্টেন্ট লাইক অ্যাকশন। ওয়াই সারফেক্টেন্ট লাইক অ্যাকশন? যদি লিপিড পার্টিকেল থাকে তাহলে কি হবে? মিশেল ফর্ম করে তাহলে ওটাকে ক্লিন করবে। সো ক্লিনিং ইজ দ্য ফার্স্ট স্টেপ। আন্ডারস্টুড? কিছুই না, এটা ঘুরিয়ে জিজ্ঞেস করলে তখন তোমরা বলতে পারবে না। এটা এটা তো মানে কমন সেন্স। নাও কামিং টু দিস ইজ ভেরি ইম্পর্টেন্ট। Cleaning products are of two types. The first type is called enzymatic products. As the name suggests, has some enzymes like amylase, lipase, etc. What it does is it breaks down organic matter. Alternatively, we can use chemical cleaning agents which has harsh action and can clean the organic matter. Cleaning can be manual, can be automatic. বাড়িতে জামা কাপড় কাচার মতো হাতেও কাচতে পারো, মেশিনেও কাচতে পারো। এবার নেক্সট হচ্ছে কোথায় ক্লিনিং করবে। দিস ইজ ভেরি ইম্পর্টেন্ট। এনভায়রনমেন্টাল ক্লিনিং। এনভায়রনমেন্টাল ক্লিনিং মিনস ইন হসপিটালস অ্যান্ড ল্যাবরেটরিজ অল ফ্লোরস অ্যান্ড সারফেসেস শুড বি ক্লিন। Now coming to cleaning, these are the few important aspects that you must understand, try to practice them, and also teach everyone else how cleaning should be done. So what are the basic principles is that before sterilization, disinfection, whatever, first step is to clean. Okay. Next step would be whenever you are cleaning anything, it could be a surface, it could be an article, whatever it may be, cleaning should always be done from cleaner area to the dirtier area. Okay. Suppose this is a room where the patient is placed and this is the door for the toilet of the patient. The toilet will be much dirtier than the room itself. So whenever you are asking the person who is cleaning them, you should always tell him to clean the cleaner area first and then to the dirtier area. They should not clean the toilet first and then clean the room. If they do that, what will happen? Most of the microorganisms that are already present in the toilet will spread to the room itself. So this is just an example. Keep this example in mind to remember that we should always clean from cleaner area to the dirtier area. Next is from high to low. What is high to low? It is the touch surfaces. Some surfaces in the world are high touch surfaces, some are low touch surfaces. So what is a high touch surface? That means surfaces which are more frequently touched. Low touch surface means those are less frequently touched. For example, whenever you enter into a room, the first thing that you touch is the grab handle of the door. And some people may push the door near the grab handle. Nobody touches the top or the bottom of the part of the door. So the grab handle will be the high touch surface. Similarly, when you go to the ward, the patient's railings are high touch surfaces, whereas the beds are low touch surfaces. So whenever we are trying to clean, we must always clean the high touch surfaces first and low touch surfaces later on. The logic is similar. Next is the cleaning should always be done inwards to outwards. How inwards to outwards? Suppose this is the door from which we enter and exit. So most innermost part of the room would be that area. The cleaning should start from that area and it should end near the exit. So that the part once it is cleaned should not be touched again. These are the simple logics. I think you will be pretty much, I think you would have understood this logic beyond these points. Just try to remember them. And finally, the frequency of cleaning will depend on what kind of patients we are dealing with. If you are dealing with infectious diseases, cleaning has to be done more frequently. What are the type of the diseases patients we are dealing with? What is the volume load of the patients? What is the workload of the patient? What kind of procedures are done in that area? For example, in ICUs, the cleaning should be done more frequently than in the general wards. Cleaning in the operating room should be daily. Okay, so depending on all these factors, the cleaning, environmental cleaning is done. Methods to test the efficacy of sterilant or disinfectant. That means whenever we are using any chemicals, we must have some method to test chemicals are actually working or not. We may be using it may happen that we are using a chemical for a prolonged period of time, but actually the chemical is not working. So what will be the outcome? There will be an outbreak of a disease. So we have to prevent that. So very frequently we must test whether these chemicals are actually working in practical environment or not. There are few tests like the Riddle Water, Chick Martin and the Kelsky Skies test. I am not going into the details of these various tests. Okay. Now, before concluding today's class, some things that you should, this slide is very important. Let us recapitulate the whole episode of sterilization disinfection. On the left hand side, we have the various methods, sterilants or disinfectants, and on the right hand side, we have the various organisms. The most resistant type is the bacterial spores, and the least resistant would be enveloped viruses. The sterilant will have action on all these, that is bacterial spores, tubercle bacilli, viruses, vegetative bacteria and fungi. Among the disinfectants, the high level disinfectants may or may not have action on bacterial spores depending on the concentration and duration, but what it does have action is on tubercle bacilli and all. Intermediate level disinfectants are used especially to treat tubercle bacilli. Lastly, low level disinfectants will have action predominantly on vegetative bacteria and envelope spores. Okay. If you understand this thing, now you can stratify and classify when and what to use and when to use. If we are using on hands, obviously we have to use low level disinfectants because we are dealing only with vegetative bacteria. Okay. The last part is you should all be aware about this particular department. This department is present in all hospitals. This is called as the Central Sterile Supply Department. So what it is? This is a layout of this department. Over here, this is the receipt count. That means whatever material that is sent into this department is received over here. Then the first step is decontamination. Why decontamination is important? Any idea? Okay. So what CSSD does? Whenever the hospital runs Many surgeries are being done daily. Many procedures are being done daily. So we need instrument sets, clothing, linen that must be cleaned and sterile. So there is a specific department which deals with these things. So what is the function of this department? They will receive the used instruments and linens, etc., clean them, sterilize them, and then send for reuse. That is the purpose of this department. The first step is decontamination. That means whatever instrument that is being presented after use, first everything should be cleaned. There are various methods of cleaning. Cleaning can be done with ultrasound, or it may be with high water pressure. Many methods of cleaning are there. I am not going to the details of the cleaning. What you must understand, all instruments are first cleaned and decontaminated. Why decontamination is important? Because obviously if there is infectious material present on them, the people working over there can also get infected. To protect them, what we must need to do is decontamination and cleaning. After that, all the instruments are packed in particular packages, the packages which can be used for sterilization. That is called as the packing. It will depend on the type of the surgery. For example, some instruments are used for gastrointestinal surgery. A different set of instruments will be used for obstetric surgery. So based on the type of the surgery department, etc., those things are packed. After packaging, then here comes is the sterilization. Many methods of sterilization like autoclaving can be used, a plasma sterilizer can be used, ethylene oxide sterilization can be done, depending on again on the type of the instrument and when it is required. After it is sterilized, those sterilized packages are stored in this storage area, and when required, they are dispersed from the issue counter. Please remember, the direction of flow of objects, instruments, etc., we should always be from this to this, that is from dirtier to the clean. Similarly, the flow of the manpower, that is the human beings, are also restricted in this way. If you see, there are pockets or doors over here. Instruments are received through this pocket. The people working over here will be restricted to this area only. They will not go into this area. After cleaning and decontamination is done, there is another pocket in the door window from where these are sent to this packaging area, where packaging and sterilization is done. After it is done, another window, it is kept in the storage area, and then from storage area it is sent out. All the people working, they will work in this respective area, so that no transfer is there from one place to the other. So this is called as the central sterile supply department or CSSD. Okay, if you do have a time, we also have a CSSD department in the hospital. If you do have a time, go and visit it. Okay, so that would conclude the overview of sterilization and disinfection.